Okay, everybody, it is February 19th. This is Michael Watson, and this is the IACT IMDHA Presenters series. We're getting geared up for the Hypno Expo 2017 in Daytona Beach. And what a time we are going to have catching the wave. Just before we got started tonight, Ralph and I were having a conversation about maybe having dune buggy races on the beach this year. I think that really would be a great addition, and sounds like a whole lot of fun. So before we get started, there's just a couple announcements that I need to make. I want to let you know that I've got you all muted right now, except for, God willing, except for Ralph. And later on, we'll have question and answer time, and then I'll show you how you can ask your questions and get off mute and all of that stuff at that time. You can get CEUs for being on this call tonight, and the way that you get the CEUs is to go to the IACT or the IMDHA website, whichever one you are a member of, and when you log in with your member ID and password, you'll find yourself at the members screen where you can indicate CEUs that you've earned. So you just let them know that you were here at the virtual conference, and or the virtual chapter or the presenter series or whatever it is that you want to call it, listening to Ralph Allocco talk about the ultra depth technique, which is our topic tonight. And you get an hour's worth of credit for an hour's worth of listening. And that's a good deal, best deal you're going to get anywhere on the planet. The recording will be available tomorrow. It'll be posted on the IACT IMDHA forum, the Mind Matters forum, for those of you who are members. Also, if you're not a member and you can't get it that way, you can go to the IACT or the IMDHA website. And at the top of the page, there are two different places where you can get the recording. One of them is under the heading that says Conference at the top of the page. And if you click on that, just go down the list and you'll see where it says Teleconferences. And you'll get a list of all the teleconferences that we've had so far. And you can download any of them that you're interested in, or you can listen to them right there. And also, there's another tab at the top of the screen that says Media. And if you click on that one, that will give you access to the Hypnocaster. And the Hypnocaster has been running for a long time. There's a lot of great recordings out there. And the most recent ones, of course, are the recordings from these programs. So you can get them there as well. What else do I need to tell you? Next week, we're going to be talking to Scott Sandlin at the same time and on the same BAT channel. And his topic will be Transcending Techniques. And that should be a very interesting talk as well. So we're looking forward to that. On May 17th and 18th, our friend Ralph Allocco, who we're going to be talking to in a minute, will be presenting a 2-day pre-conference workshop on the ultra-depth process. And so if you're curious about the ultra-depth process, there couldn't be anybody better to tell you about it than our guest tonight. So let me just tell you a little bit about Ralph, and then we will bring him on for you. Ralph is a registered ultra-depth facilitator and educator. He's a hypnosis instructor. He's an international lecturer and a therapist, and he's been practicing hypnosis for over 15 years and teaching hypnosis for over 10 years. He's trained in hypnosis by Paul Arand, by Roy Hunter, by Robert Otto, by George Bien, and by James Ramey in the ultra-depth process. Ralph is one of the only instructors with exclusive permission to teach the ultra-depth process in the United States. That's what I had originally, but as of this summer, I guess it was about June, James Ramey passed, and upon his passing, Ralph has become the ultra-depth international president. So we're sorry to hear about James, and really happy, Ralph, to hear that you are president now. So welcome. I've been looking forward to talking to you.
Thank you. Thank you, Michael.
Yeah. And there's a whole lot of stuff that I want to talk about. But first, this thing about ultra depth. It's kind of funny because I had sent a note to one of my friends saying I was doing this tonight, and we're talking about this ultra depth technique. And so we wondered whether your course comes with a rope ladder. help people get back out when it's over. So it's rather mysterious. It's a mysterious name. People don't know a whole lot about it. So if you can tell us what is the ultra depth process?
Well, if you don't mind, first I want to tell everybody that James Ramey was the founder and president of the ultra depth. He received it from Walter Secourt, who actually discovered the ultra-depth levels, the best way I could say it. He passed the baton to James Ramey when he passed on, and Jim has taken it to an international level. He has taught thousands of people. He had taken me from, in 2006, yeah, it's 2006 that I started with James Ramey as far as the ultra-depth process. It took 3 years before he actually made me an instructor, and he kept me in the United States with him as the only other instructor. We have instructors in Australia, China, Korea, Germany, Denmark, England, and we are just passing it around the world, teaching people what this process is. I want to thank James in his passing. He has taught me so much. He was not only my teacher, my mentor, he was also my personal friend. But the ultra-depth process goes what we call beyond traditional hypnosis. Traditional hypnosis, as most of you were taught, brings you to a light state, a medium state, and then the somnambulistic state. So that's where hypnosis kind of ends, and the ultra-depth process picks up. We pick up from there to go deeper. While we are in somnambulism, and we go to profound somnambulism, which is the deepest level that you can go within realm of hypnosis. So to get past that, we go into the Esdale state. And the Esdale state is the next level, deeper than profound somnambulism, which was discovered by James Esdale, and he used in India over 5,000 operations he performed because they didn't have any anesthesia or chemicals. He was able to bring his clients deep enough into state where they had no discomfort, no pain, and they had control over the blood flow within the body. He performed amputations, different surgeries, over 5,000 of them. And that state we now call, which was called the coma state, is now named the Esdale state. It's been that way for a long time. The coma state, or hypnosis, the hypnotic coma, you may have heard that in the past.
Sure. Ralph, do you mind me asking you, I think I have told you before that I saw Walter Secord a long time ago at a hypnosis conference.
Right.
And he put a woman into this deep state, and they had folks with stethoscopes and stuff checking her vitals and stuff, and it was truly impressive. Is that the Esdale state?
The state that Walter Secord was bringing them into is the ultra-depth state. This is the next state after Esdale. The Esdale state is a complete locking of the skeletal muscles, where you have someone rigid. You've seen them put people between two chairs. Right. That is what the Esdale state is. The next state is the Secord state, and these people were checking with stethoscopes and what have you, is the flaccidity of all muscles within the body. You've seen a rag doll. Take a rag doll. There are no bones, no nothing. It just flops over. This is exactly what the Secord state is. The body will just become loose, limp, and relaxed like a rag doll.
Nice.
And with that state, they can press on anything. There are no tension in the body at all. So this is what Walter was doing, and he would demonstrate it with Sarah Zane, his assistant. So that is what the Secord state is, which is deeper than the Esdale state.
The SDL state usually is evidenced by catalepsy. Is that right?
Catalepsy is mainly used in a light state. Catatonia is your deep state. Catalepsy will give you in a small area, a small bit of rigidity. But to get full body rigidity, the catatonic state is where you want to be, where you have deep skeletal muscle lock, where your regular muscles, your body muscles are all loose and limp. Mm-hmm. They're not what's holding it, but the skeletal muscles within your body are what is holding your body rigid. That's where the Esdale state goes. With a light tapping, the arm comes down, the legs come down, and you're getting on the threshold of the ultra depth state, which we named the Secord state in Walter's honor. Okay. So taking that into consideration, we also have what we call reverse staging. Coming back, when you have a client and you bring them into profound somnambulism, the deepest level of hypnosis that we have, what we're actually doing now is going through doorways. We go through a doorway to get to the Esdale state. We go through another doorway to get to the ultra depth Secord state. Okay. But now we also have another doorway to do reverse staging, bringing someone back to profound somnambulism while they're still in an extra deep state of hypnosis. When we do that, now we have control over the vocal cords, because in the Esdale state and in the ultra depth state, the only one that can speak to you is the subconscious. The conscious mind is out. And what we always say is here, what we do is we're looking to get past the critical factor. And most of us are taught that the subconscious is the critical factor, the unconscious is the critical factor. And what we believe within the ultra depth process, we know that when we come into this world, we come in as a subconscious and a brain. And the brain has some predetermined programs already written in it, but the subconscious is now writing programs and feeding the brain just like a CPU on a computer. Mm-hmm. The subconscious writes the program, the brain distributes it. That's where your movements are. You don't think about blinking your eyes, right, or taking that inhaling, right? You don't say, "Oh, I forgot to inhale." Yeah, it's done automatically because the subconscious is what controls all bodily functions. So, with that in mind, when we have someone in a hypnotic state, we actually have the conscious mind right here with us, along with trying to bring in whatever behavioral change we want to work with, however we want to talk with our client about anxiety, whatever we want to, maybe there was a trauma, but we can't get through. But if we relax the client enough, we're moving the conscious mind out of the way to where we now have access to the subconscious. So the subconscious can rewrite the program of whatever it is that's disturbing the conscious mind in our everyday life.
Cool. I'm hearing something implied in there that I wonder about, because, you know, we had a talk, I think it was just last week, there's so many that it runs together, but we had, I think it was last week with Sherry Gilbert, and she talked about moving beyond scripts and doing what she referred to as transpersonal sessions. And this idea of, you know, talking back and forth with your client and getting access to their unconscious mind. Similarly, it sounds like, if I'm understanding you correctly, that there's dialogue then back and forth between the hypnotist and the client in this process, as opposed to just offering them a script. Is that correct?
Oh, without a doubt. This is not, what we do is not, you will not do this, you will not do that. What we do is
two-way conversation.
it is a two-way conversation. This is where we want to have our client in a profound somnambulistic state. And we can have our conscious mind here. As we relax, it moves over here. And then it'll move over here. What we want to do is put it out there. So now it's not going to come in and interfere and interrupt what we're looking to do. And what are we looking to do for our client? We're looking to do for our client what we have at the table when we sit down and do our intake. Why are they there? What is it that's going to be in the highest good of this client that we can help them? Who knows what's best for this client? The client themselves. We can't put in our thoughts, ideas, or concepts into their life, for they know what's best for them themselves, and who better to ask but the one within, their higher self, their subconscious mind.
Lovely, lovely. Yeah, I really appreciate that.
This is what we teach. In our 2-day class that we're going to have, we're going to go through this. Because in order to reach these levels, you have to know that you're going to be there. How do you know you've got your client there? If you're just talking, you don't know what level your client is in. There is a series of deepening, and there's a series of different ideas and ways to teach the client how to reach down into these depths. So when we have a client and we reach somnambulism, this is mainly where everybody is not recalling that one number, or what we call a number block.
Right.
So we actually, in ultra depth, a lot of people count from 10 down to 1. We actually count from 1 down. When you went to school, you went to write the numbers on a blackboard. Teacher said, Johnny, go up to the blackboard and write the numbers. You would start at the top and put 1, then 2, then 3. You would go down to 10, and then you would list whatever it was. Mm-hmm. Now, the other object of it is we are grown with this. We go to school. We learn. 1 is less, 10 is more. Our money shows us this.
Oh, sure.
$1, $5, $10. So what are we looking for when we want to bring a client deeper into state? We're looking for more relaxation. More. Nice. So if I were to go 10, 9, 8, 7, I'm getting less. Yeah. The brain gets a little confused. Now, some take it. There is no ifs, ands, or buts. This has worked for many years. This has worked for centuries. What I'm saying is we have found a way to help guide the client deeper and faster into the state of what we're looking for.
Sure.
And as we do it, we're looking to test the client at each level. Now, we test at somnambulism. That is the non-recall of one item, or the number block. But when we get into profound somnambulism, we teach our client, we actually ask our client 6 questions. As a matter of fact, I'm going to count from 3 up to 1. And when I reach the number 1, I'm going to ask you to open your eyes. And when you do, you will find that not only will you not be able to recall the number between 6 and 8, but you won't be able to recall your own name. As a matter of fact, you won't be able to recall your date of birth. As a matter of fact, you won't be able to recall the street that you live on. As a matter of fact, you won't be able to recall the town that you live in. As a matter of fact, you won't be able to recall the type of car that you drive. 3, 2, 1. Do me a favor, count from 1 to 10 very quickly. 1, 2, 3, 4, 5, 6, 8, 9, 10. Now I know I got it. What'd you say your name was? What street do you live on? What's your date of birth? You don't want to give the client too much time to start to think, because then that conscious mind is starting to come back.
Sure, sure.
Once you have it, I get rambunctious here. But once you have it, now you know you have your client in profound somnambulism. Once you do that, close your eyes, let your body relax. Now you're going to deepen them again, along with setting up a key word. Okay? So now, whenever again you hear the word Fantasia, whenever again I say Fantasia to you, this is the level of relaxation that you will return to instantly, spontaneously, without hesitation or delay. Fantasia will bring you back to this wonderful state. So whenever again I say the word Fantasia to you, now what did I just do? I just said it 3 times.
Sure.
I made sure I locked it in. So now what I'm going to do is I'm going to count in state. I'm going to say on the count of 3, I'm going to ask you to open your eyes. 1, 2, 3. Eyes open. That feel good? Yeah. Fantasia. Close your eyes. Let your body relax. What did I do? I just reverse counted, didn't I? So I had him open his eyes while he was in hypnosis.
Right.
In a deeper state. So now I'm going to do it again. I'm going to test it again. Only this time I'm going to say, in a moment, I'm going to count from 3 up to 1. Now I'm going to bring them up. 3, 2, 1. Eyes open. How do you feel? You like that? Wasn't that wonderful? Isn't that a wonderful state to be? And as he's saying, yeah, I really love that. As he's saying, yeah, I really, Fantasia.
Fantasia.
Bam! In he goes. So now I know I have profound somnambulism. Now I can work right here because I know I have a deep level. But I still have kind of the subconscious right here.
Sure.
Let's bring that subconscious all the way over. Okay, so now there is even a deeper level than what you are enjoying now. And in order to reach that level, blah, 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 we have to do this. This is part of my course.
Mm-hmm. Yeah.
But this is what we're doing. When we have this 2-day class, we're going to teach, I am going to teach, exactly what to do and how to test the client doing this. Mm-hmm. We're going to do some pre-induction exercises, showing you how to get the trust of the client so you know what induction to use. Whether you could use a speed induction, whether you need to do just a little longer induction, or whether you're going to do a progressive relaxation.
Okay.
And you can bring someone into the ultra-depth state deep enough within a progressive relaxation. But you have to have the heart. You have to have the intention to help your client to bring them back.
Sure. I think that's the magic ingredient.
Right there.
You know, something I think that the people listening might be interested in knowing, because this, profound hypnosis, this is a fascinating idea in the first place. But here's the question that we haven't really gotten to. What's it for, Ralph? What kinds of things, what kinds of issues would you use a technique like this with?
Any issue.
Anything.
Anything that you are using it for now, what you would do with getting the depth of what we do, you will get a longer lasting scenario. Mm-hmm. Whatever it is you're working with for your client, it would come quicker and it will last longer. Up to permanent. Now, there are a lot of people who don't like, no, you can't do anything permanent. Yes, you can.
I'll give them something permanent.
But that's what it is. I mean, there are so many people that say, oh, you can't do that. You know what? I'm not doing anything. In all honesty, everything I do comes from the client.
Yes.
I am going to guide them. I'm going to talk with them. I'm going to find out from themselves what is the issue. How about road rage? I've got a guy that went to 5 different people for road rage.
Mm-hmm.
And I'm not just talking about hypnotists. I'm talking about he went to doctors, he went to psychiatrists, he went to psychologists. Road rage. Everybody's telling him something different. I'm not going to get into that, but I'm going to tell you, when I brought him deep and I reverse staged him to where I can talk with the subconscious, this road rage that was within him, when he was 8 years old, his father lost his job. They had to move out of the house that he loved. They were renting a house in a much, much poorer neighborhood. He was a white child, and he had to go to an all-black school. He learned to fight at 8 years old because he had to survive. And it boils down to, we all know, how do you handle that? What could he do? First off, we brought the adult back to the child.
Mm-hmm.
We brought the adult back to the child to try and help the child for when the child got scared. But that's when the road rage really came out.
Sure.
Was when the child got scared.
Sure.
But then again, this boy's mother didn't want him around. She was scared of him. His wife would not have a child with him. His job was ready to fire him because he would jump down everybody's throat. We went deep enough back. We found out why and asked the adult to go back to him. Right?
Nice.
We'll talk with that. My training from George B.N.
Yeah. Yeah. Yeah.
I'm going to put him in there because George was great. But that's what I got. You know, I said, how if the adult goes back? But now, what do we do? What do we do with this client? So now we take this client and we ask him, what job are you going to do now? You've been doing this since you're 8 years old. Do you know what's happening? Do you know what you were doing? Can you tell me what you were doing? Because he knew his mother was afraid. He knew his wife was afraid of him. And he told me, how can we change this? And I'm asking the question. Do you want to change? Is the first question I asked.
Yeah.
Do you want to change? Yes, but I can't help it. What do you think you should do? What could you do? You have this ability. You're a great fighter. You have this ability.
Mm-hmm.
What can you do? What could a great fighter be? Instead of the rage, what could it be?
Nice.
I could be a protector. I could protect them.
Oh, nice. Beautiful. Yeah.
He didn't come up with it, though. He came up. When they come up with what it is
Yes.
to change, your job is 3/4 done.
You bet. You bet.
Your job is 3/4 done. I had 3 months later, this woman came in my office and threw her arms around me and said, this guy's wife.
Mm-hmm.
I have a new husband.
Was she a bad driver?
I didn't get into that. I didn't get into that. But that's one. That's one story.
Yeah, that's lovely.
You know, that's something using deep hypnosis to come back and have them come.
Well, here's something that really impresses me is that because of the profundity of the state and what I mentioned that I saw Walter do, it's relatively obvious that this is something that you could use for surgery, for example. Now I'm hearing you talk about age regression with this, and by the way, just curiously, do you do or can you do or have you done past life regression?
I've done past life regression. I will be showing. I do past life regression with eyes open. whereas the client will see themselves in the surroundings they're in at the regression, not in my office. They will see that. But before you get to that, you had mentioned surgery.
Yeah.
I have not done one yet with that factor. I've done dentists where tooth can be done. James Ramey guided a woman deep enough into state. She could not have anesthesia. She could not have any kind of locals. They had to do a liver transplant. Utilizing ultra-depth hypnosis, she was going to die. That's the only way the doctors in the hospital allowed it to start. She came out perfectly fine. The liver transplant took. Jim got a call from her sister, and all he could hear was, no pain, no pain, no pain.
Nice.
The object of it is, with ultra depth, whatever healing you want to do will happen 6 to 10 times faster than normal. While in the ultra depth state, the body doesn't have to do anything else. Your subconscious, as I said in the beginning, runs all bodily functions. It takes care of everything. If it's not taking care of everything while you're in state, your body starts to heal. So while using it for any kind of surgery, the body will heal itself 6 to 12 times fast, 6 to 10 times faster.
Nice.
So now, that is one of the major issues. We have a technique we use. It's called mind-to-mind healing. Whereas 2 subjects, one can get into the ultra-depth support state, clasping hands together, interlocking, we can help one body energy pass to another body's energy to help heal that body. And that's what happens with what we call mind-to-mind healing, which is one of the techniques.
Oh, nice.
Reverse staging. Now, when you're in profound somnambulism, we can speak. We have vocal cord usage, and we can move. While you're in Esdale, you cannot move. You have no control. While you're in support, the body is so flaccid that it's limp. Yeah. When we bring them back to reverse staging, from the waist up, we can move, we can talk. So this is what we can. They cannot get up. Mm-hmm. I have many clients that we do. At our IACT conference, I've done the staging once. We have our meetings on Tuesday nights on Long Island. Everybody is welcome to come to our meetings on Tuesday nights.
Okay, we'll be there.
New York and Long Island. But we do demos every day, every time, every week we have, every month we have a meeting. Someone does something different. I have a young lady, one of my first that I staged, and that was like 6.5 years ago. Now, actually, maybe 10 years ago. I staged her. She still has her key words for each level, and all you need to do is drop them into state. And I say it this way. All I have to do is say her key word, and she's in state, and then we go directions from there.
How beautiful. Ralph, the time is moving right along, and we want to make sure if anybody's got any questions for you that they get a chance to get them in. So I need to give them a little bit of instructions about how to do that. The folks that have been on the call so far have probably already figured it out. But for those of you that are, you're all muted right now, but down at the bottom of your screen, or somewhere on a menu, depending if you're on an iPad or something different, it might be a little bit different. But there's a little place that you can click that opens up a participants box. What you'll see is it just says participants. And if you click on that, you'll see a list of all the people that are on the call right now. And at the bottom of that participants box, there's a tab that you can click on to raise your hand. That's how we will know that you have a question. So you can find the participants box at the bottom of your screen, and just click the raise hand down at the bottom of the participants box. I hope that that's clear enough. If you have a question, and if you're on the telephone and you have a question, the way to do it is to just dial *9, and it'll show me that you've got your hand in the air, figuratively, and we'll be able to call on you and open up your mic so that you can ask a question. So if anybody's got something for Ralph, feel free to go ahead. And Ralph, I got to warn you, sometimes they're a little bit shy and slow about this. And that just means that they can talk about whatever they want. Oh, but I see that Kathy Cass has her hand in the air. I am taking you off mute, Kathy, and you can go ahead and ask your question.
Yes, hi Ralph. I'm wondering if any music, something that takes you to the Delta state, can also, do you ever use that kind of music, binaural beats or something else? There's a lot of stuff out there now that can take you pretty deep. And I was wondering if you ever use music when you're working with your clients.
I actually don't, but we do have music for soothing, number one. Number two, there are many different ways to reach many different states. What we teach is, in the Ultra Depth, we have a complete process. But I am not saying that it is the only way. There are many different ways to do it. Mm-hmm. And if you're utilizing music and you have a way of doing that to help your client, everything you do to help your client is definitely a positive.
Great, thank you.
So I'm willing to learn also.
Do you ever come out to California, to Southern California, to do classes or workshops?
I am actually working on putting together a class. And if you were to email me, I would put you on the list. I'm working on a class right now for California. I have a location and a place to have it. But I'm now I had said James Ramey passed away in June. I am still going through all of the students that he had and some of the people that he had scheduled. I've taken on that whole load. So in that respect, I just haven't put that on the top front of the burner. But it will be happening within the next 3 to 6 months. I will be looking to put a class together for California.
Ralph, I'll be in touch. Thank you.
You're welcome.
And Ralph, if you would, let people know how they can get in touch with you, your email address.
Ultra Depth International website. You can actually email me directly at ralph@ralphallocco.com, Mr. Ultra Depth at ultradepth.com, and you will be able to reach me in any which way. I am in the process of redoing the website. I had to change the host provider. So the website is only halfway done. I still have a lot of Jim's stuff on it, and I'm looking to put some of my stuff on.
And by the way, I might just add that ralph@ralphallocco.com, if you don't know how to spell it, it's double everything. I struggled with it a few times, but it's double L's and double C's, ALLOCCO. So ralph@ralphallocco.com will get you to him. And Mr. Ultra Depth, is that what you said?
Yeah.
Ultradepth.com?
Yes.
Great. And of course, I imagine that the website is www.ultradepth.com.
Yes. You can put in UDI. Ultra Depth International.
Ultra Depth International. Oh, just UDI.com?
Yes, that'll work also.
Oh, great, great. So all kind of ways to get in touch. Anybody else that got any questions? Oh, I see a couple hands. Let me see. We'll go to David Pearson here first. So Dave, I am unmuting you now, so go right ahead.
Thank you. Ralph, I just wondered if you've been able to receive any feedback on working with drug or alcohol dependence with Ultra Depth.
It does work. I have not had any, I will tell you that. But Jim has had some, and I have not researched his information as of yet. But it does work with any kind of abuse that we do to ourselves, along with, it is more or less a behavior modification, but it's getting the chemicals out of the body first.
Great. Okay, thank you very much, Ralph.
You're welcome.
Lovely. And we've got another one here. Let me find it. I think that yes, it is Pedro. Pedro, I have unmuted you, and go right ahead.
Hi, Ralph.
How are you?
I'm doing great. Thanks for the info. I'm very interested in PTSD, and I was wondering if you have like an average or something of sessions that you're, that you can use ultra depth to kind of help somebody with PTSD.
An average number of sessions depends on the person,
Mm-hmm.
and how long it takes them to guide them to state. I have people I have brought into deep ultra depth state in 45 minutes, and I've had people that have taken 4, 5 sessions. All right, so each person is different. Whereas when I said in the beginning, we'll be going over what we call pre-induction exercises, and I call them exercises because whenever you go with a pre-induction test, people think of a test and they think they can fail. But when we go with an exercise, we're looking to see how well they're going to trust us. And what we do is what's called a lean back, come forward, whereas they actually have to lean back and you have to catch them in a certain fashion. This way here, you can show them, I am with you at all times. Just as if we were doing the lean back, come forward, and I supported you. I am here supporting you now. So please, guide yourself deeper and deeper. And this is how you get your client into the deeper state to find out.
No, does that mean that once they get to that level, the change is pretty much immediate?
It's not you didn't do a change. What you did was you brought them to that level. Now you're going to find out what it is in that post-traumatic stress disorder, what it is that's bothering them, and how to correct it. You're not going to tell them, in my opinion. I don't do it that way. I ask them, what can we do to correct this? What's going to help? If we bring back the adult, now, with all of your, now you have all of this new knowledge, information, you have a way of helping this one. I don't know what age is we're talking about. When did this PTSD start? Did it start a year ago? Did it start 5 years ago? Did it start 6 months ago? Now, with all the information that you have, can you go back and help that person? Mm-hmm. One that's in trouble. And then you can work from there.
Nice. Great, thank you.
You're welcome.
Yeah, thanks for the question, Pedro. All right, so I'm looking at my clock, and it appears as though technically our time has run out, but I want to just give for one more minute here, Ralph, just to make sure. Is there anything that you've got left that you want to make sure that we have said or let them know about your class or something? And
yes, there is.
Please.
Yeah, the ultra depth class to reach the ultra depth state is a 5-day program. It is a 5-day program to do this. I have done it on 2 weekends, Friday, Saturday, Sunday, Friday, Saturday, Sunday. I've done it 5 days straight. The object of it is when you attend the class at the IACT conference, the full price of your admission for that 2-day class will be credited for the 5-day class. I am going to be doing 2 classes in New York. So whatever the credit is that you have paid, whatever you're paying for the 2-day conference class, for the introduction, which you will be learning how to test your clients for the deeper states, how to do the pre-induction exercises, and I will be there to answer any other questions. So you will get a full credit for that.
Great. All right. Well, first of all, I want to thank you, and I'm going to say thank you again in a minute, but let me just wrap up with letting people know we have recorded this evening once again. So if you just can't get enough of Ralph and you want to hear it again and share it around, you can go to the website of IACT or IMDHA, and you can download this under the tabs Conference or under the tab for Media. Or you can also go to the IACT IMDHA forum, the Mind Matters forum, and you'll be able to download it there tomorrow. And if none of those things work, or you just don't have access to that stuff, you can also send me an email at flhypno, just remember Florida Hypnosis, flhypno@outlook.com, and I will send you a link as well to the recording for tonight. And if you've just been on the phone, by the way, the nice thing is when I send you the link, you'll be able to see us and realize just how you missed the charm and the splendor that you could have enjoyed this evening once you've actually got the video, and it will be yours to keep. So I hope you enjoy that. So now, Ralph, I just want to let you know how much we appreciate you being here. We're glad to have you. Your talk tonight was very helpful, and we want to encourage these folks to sign up. The website is available now. By the way, we have a shortened URL for the website. It's just hypnoexpo2017.com. We'll take you right out to all of the information about the expo and a place where you can register and find out the various prices of everything and anything that you want to know. So get out there and do that. Register soon and often, and be sure and get yourself a place in the hotel, because who knows? The best rooms could sell out. So take care of that at your earliest convenience. And we will be here for another 10 weeks doing these programs on Sunday nights. So come back next Sunday night. You'll be able to hear Scott Sandlin. And now I'm going to do the most dangerous thing that I do every time in these calls. In a moment, I'm going to unmute everybody. So it will be sheer chaos.
Pandemonium.
And it just gives them all an opportunity to shout out their goodbyes and how much we love and appreciate you and all that good stuff. So
thank you so much, Michael, for having me here.
Thank you so much for being here, Ralph. And the lines are open now.
Oh, thank you,
Mike.
Michael. And thank you, Ralph. Great job.
Good night.
Thank you. Good night, Michael.
I hope to see you all.
And come back next week.
Bye-bye.
Bye-bye.
Bye-bye.